Subclinical atrial fibrillation, which is commonly detected in patients with implanted cardiac devices, is associated with an increased risk of stroke, but it's unclear whether oral anticoagulation can reduce that risk. A new trial examined the stroke-lowering effects and safety of Apixaban as compared with aspirin in patients with subclinical atrial fibrillation in this context. In this international double-blind, double-dummy randomized trial, 4,012 patients who had device-detected episodes of subclinical atrial fibrillation that lasted 6 minutes to 24 hours and who had stroke risk factors were assigned to receive either oral Apixaban at a dose of 5 mg twice daily or aspirin at 81 mg daily. If subclinical atrial fibrillation lasting more than 24 hours or clinical atrial fibrillation developed, trial medication was stopped and anticoagulation was started. After a mean follow-up of 3.5 years, the primary composite efficacy outcome of stroke or systemic embolism occurred at a lower rate in the Apixaban group than in the aspirin group, at a rate of 0.78% versus 1.24% per patient year. The primary safety outcome of major bleeding occurred more frequently in the Apixaban group, at a rate of 1.71% per patient year, as compared with 0.94% per patient year in the aspirin group. Fatal bleeding occurred in 5 Apixaban recipients and 8 aspirin recipients. The authors conclude that among patients with subclinical atrial fibrillation, Apixaban lowered the risk of stroke or systemic embolism, but increased the risk of major bleeding. Full trial results are available at NEJM.org.